Hello, good morning, everyone. So I'm sure if they ask you among these five urine samples, which one is actually the best? I'm sure a lot of you would want to go for this particular one. Okay. So this particular one is not actually the best. We actually collected this urine sample from a diabetic patient. Okay. Now, this is actually the best urine sample color. All right. So we call this amber color. Now, this a lot of patients that have this urine sample color is always afraid. People don't want their urine color to be like this. They rather want it to be white. Okay, so whenever their urine color is somehow yellowish like this, they call it that they're having malaria or typhoid or whatever, and you see them start going to pharmacies to start treating malaria and treating these things. So urine sample color that is this doesn't mean that you have problem. Now, this urine is telling us that these two things can happen. Could be that this patient is actually well hydrated, means that the person has taken enough water, or the person is diabetic, or there are some other conditions. Somebody that is on diuretics that is making the person to wee many times can also have this kind of urine color. So this is actually pure water, like pure diluted. So this is not actually the right urine color. It can tell us a lot of things. So after that, so this is the normal one. Now, we also collected this one from a patient that is dehydrated. Okay, this patient was actually is very sick and has not taken a lot of water, so we collected this urine from a dehydrated patient. So when you see this kind of urine, it could tell you that you're dehydrated. It still does not necessarily mean that you have malaria. Yes, people that also have malaria can also produce this kind of urine. Okay, so also note that. Then we collected this part of this urine from a patient that have liver problem. Okay, so you can see how yellowish this urine is compared to this particular one. So you see how light yellow this one is. You can see deep yellow. This one is deep yellow. So you hardly will see this from a malaria patient. You only see this in patients that have liver problems because of the excess jaundice that you're seeing here. All right. Then we collected this from a patient that has a kidney problem. We call this hematuria. Okay, we collected it from a patient that have a kidney problem. Okay, this can also be seen somebody that have a bladder infection, somebody that have urethral infections that is bleeding into the bladder and stuff like that. So these are different urine sample colors. So the presence, so everybody, so the essence of this topic is everybody must not have this, and this does not mean that your urine is fine. So I've